We're probably by and large done with nutrition for now, though we'll circle back to certain aspects of it when we talk about supplements. But let's move on to the second major contributor to prehab and surgical outcomes, which is physical activity and exercise, both in preparing for surgery and in supporting recovery afterward. Could you walk us through the different ways exercise matters, and what, in your reading, are the tools from the exercise domain that offer the best return on investment for someone preparing for surgery?
It really depends on what your baseline is. So as someone who does breast reconstruction, most of my patients are deemed healthy. They're walking into the clinic visit. They're not on death's door. So if you are very sick, like any physical activity is going to help your recovery. Just like getting to sit up on your own is going to make a very meaningful difference. But let's talk about healthy patients, because it's very easy to identify a sick patient saying, we got to work on your physical fitness. But someone who comes into clinic, they probably think that they're pretty fit. They walk once a day. They don't think they need to do anything before surgery. Those are the patients that I see and I really like to talk to about physical fitness. Physical fitness has really changed in the last 20 years or so, especially for women. I grew up in a time where cardio was what you did. If you were a female, when you went to the gym, you got on the elliptical. Women didn't lift weights. And thankfully that narrative has changed. We now know that weightlifting and resistance training is not going to make you look masculine, but it is so important to offset that loss of muscle mass that occurs as we age, especially as we get to perimenopause and menopause. Healthy patient who's preparing for surgery, yes, cardio is still good. That zone 2 training is so healthy for your heart, long-term health and wellness. But what I really like to focus on is, once again, increasing your muscle mass. And I used to tell patients, just do anything that increases your muscle mass. You like to do squats, do squats. You want to do push-ups, do push-ups. And yes, that helped. But I then received feedback from patients saying that if they worked on muscles that they relied on after surgery, it really made even more of a difference. So for me, I will do breast reconstruction where I use belly fat. So they can't use their arms, they can't use their bellies for 6 weeks after surgery. So the best thing they can do before surgery is to increase their lean muscle mass of their legs, because they're going to be basically doing squats to get up and down from bed, to get up and down off the toilet. So that strength is going to empower them after surgery to be able to do things more on their own, rely on less people. And it's, once again, it's just building that lean muscle mass like we just talked about that's going to be dipped into after surgery. So I am constantly telling women, you got to lift heavy things. It feels weird. Do it in your house. Go to the playground and lift things, do pull-ups, push-ups, but you got to increase your muscle mass before surgery.
Right. So essentially you go both about bulking up in general and also banking the support muscles that would aid in the post-op period to provide that more of independence and mobility. You know, in this instance, I really like this idea of banking, like building something in preparation for a certain life event. And for myself and people I work with, I even shape this into a slightly further, a bit of a similar concept of banking early. Banking muscle, banking bone mineral density, banking cardiorespiratory fitness, banking cognitive reserve as early in life as possible when we have high neuroplasticity, we have high anabolic capacity, and essentially how we use this window up to our 20s, 30s, or 40s largely determines how much physiological reserve we carry forward. And that doesn't mean that if we start later, past 50 or 60, there's nothing to be done, because there's actually a lot we can do, and we have evidence, clear evidence we can build muscle effectively at any age, provided training is robust, protein intake is adequate, and we have prioritized recovery. And the same applies to cognitive reserve. We can still build that later in life by learning new languages, new motor skills, and even if the efficiency is lower than in earlier years, it's still worthwhile. But ultimately, I'm convinced that as physicians and health span, lifespan enthusiasts, we should be teaching and preaching since early years, and this is something I say to my kids, that we should responsibly use that cusp of the human physiology when we're all primed for growth, primed for adaptation, and this is when we bank as much reserve as possible in the form of muscle, bone, neural capacity, and more. This clip is from an episode of the Sokolov MD podcast featuring Dr. Rebecca Knackstedt, where we discuss the role of prehabilitation in maximizing surgical outcomes. You can find the full episode by following the link in the description.